They're talking that nothing is existing, nothing is working, nothing is nothing. It's much better if you do bench press with the dumbbells, because always your brain, it's idiotic for me, because you know, trigger points. We have here the problem with trigger points. You will hear some people in those days, you have specific guys like Adam Mickens, you probably heard about him, and specific haters in our physical therapy profession. They're talking that nothing is existing, nothing is working, nothing is nothing. So they say that trigger points are not existent because we cannot find them physically. What I mean? When you open somebody, if you try to find trigger points, you cannot find it. Because if you open somebody, it's two situations. He's in complete anesthesia, whole body, you cannot have trigger points because the muscles release, or he's dead. If he's dead, he do not have any muscle tension, logically. But when you do ultrasound, you can see muscle tensions. So when somebody says trigger points does not exist, it's idiotic for me, because you know, every one of you probably massaged in their own life. When you do massages, you can feel that on one side everything is really normal tension, and on the other side you have really high tension. Of course, that's hypertension, and it exists. But they are not like trigger points that people explain, oh, those are those points that are always tense. No, trigger points are just muscle tensions that are there from some compensation in the locomotor system. Scoliosis is the best example. So when somebody, I have left side scoliosis because I have played professional basketball, so it's normal to be on the different side. So when you have scoliosis, what you will have? On the left side, you will have muscle tension, of course, because that side is short. On the right side, you will have muscles released and weak because that side is long. So that's logical that you will have, because of compensation in the locomotor system, one side is pulling more and you will have muscle tension. That's why I always talk to patients and people who are working out that it's much better if you do bench press to do it with the dumbbells. Because always your brain will use your energy maximally efficiently. And if you take barbell and you push it, you will always push it more with one side. Because your brain wants to use the least energy possible so that you can survive. It's survival instinct. And if you take barbell and push it, you'll push it just a little bit more with the stronger side. If you take dumbbells, you cannot do that. That's why I always work out with my patient unilateral exercise. Always unilateral exercise so that we can get balance in the whole body so that the muscles can work the same.